Hello, this is the second video about MDMA. The first one was about the history and the effects and the mechanism of MDMA. This video is about the toxicity, its features, and how to manage them. I'm going to talk about toxicity in a short-term way, not a long-term way. And what I mean is I'm not going to discuss whether there are long-term effects of MDMA use or not. This is a really controversial issue. There's a lot of bad science and publication bias. I'm just not going to go there. Let's focus on what you do in the short term when someone comes in intoxicated with MDMA and say you're working in the emergency department. I'll just remind you that the effects of MDMA go into these three broad categories: stimulant, autonomic, and cardiovascular, and the toxicity really stems from the effects in these three categories. I'll touch first on the causes of death, which I think is important to always bear in mind. So the number one killer for MDMA toxicity is hyperthermia, both because of inherent heat production and also because of high ambient temperatures that increase the risk of death, for example, on a hot day or in a hot nightclub. Secondly, and this goes along with the first, dehydration, another big killer. And then thirdly, we get hyponatraemia that can either be because of SIDH or more commonly is just because of overcompensation for the worries about dehydration. When people drink too much water, it dilutes their sodium down and then they get cerebral edema because of the hyponatremia. Don't forget there's a lot of drug interactions because people that take MDMA often take other drugs, and this does increase the risk of dying. I'll just touch on this other substance called PMMA. It's a related amphetamine. It's got a nickname of Dr. Death. Occasionally gets mixed up with MDMA and gets dealt to people who don't realise they're buying it, and has a really high rate of death when people do take it. There's been a spate of deaths in Europe over the years from what was later found to be PMMA. The management I'll go through when I talk about each different feature of the toxicity, and we'll discuss a feature and then we'll talk about how to manage it. So firstly, you can get symptoms of serotonin toxicity, especially if they've co-ingested with an opiate or another serotonergic agent. And the management of serotonin toxicity is going to be discussed in another video, but essentially boils down to cooling, sedation, and then sometimes the use of serotonin antagonists. In terms of the autonomic features, remember we had hyperthermia as one of our big killers, so the management of hyperthermia is absolutely critical to management of MDMA toxicity. That means actively cooling someone with IV fluids and ice packs once their temperature is approaching 39 or above. And if they're approaching 40 degrees, you really need to consider paralysing them and intubating them so that you can reduce the heat produced by their muscles. And if you're really stuck and you're in a tertiary centre that can do this, ECMO can cool the patient's blood outside of the body and then return it to them at a lower temperature, so it can manage extremes of temperature and help avoid multi-organ failure. In terms of the CNS effects, we manage agitation with benzodiazepines, and you can also sedate with antipsychotics like droperidol. That's been shown to be safe in the pre-hospital setting. In terms of seizures, as another CNS effect, we manage those with benzodiazepines. Will be given IV this time, and you probably have to use higher doses than just for sedation. You want to manage the cardiovascular complications, which include hypertension and tachycardia, A, with benzodiazepines again, but B, sometimes you can use glycerol trinitrate as an infusion if you've really got uncontrolled hypertension and it's an emergency and you want to bring the blood pressure down. In terms of metabolic, the metabolic system, we've got hyponatremia as our main one. That you would want to fluid restrict them for, but obviously that might contraindicate what you're trying to do in terms of volume resuscitating them if they're dehydrated. And you may also consider hypertonic saline, but you really should be discussing that with an intensivist and a toxicologist if you're thinking about it, because it's difficult to manage this one, and it's only really indicated if there's severe hyponatremia or if they're getting seizures or a very altered mental state. I'll just mention also that you want to try and avoid prone restraint for people that have MDMA toxicity because of the effects on the metabolic system, and you want to avoid prolonged restraint altogether if you can. So the other effect that I'll just touch upon is rhabdomyolysis. They get muscle breakdown, they get raised CK, and then they get renal failure and myoglobulinemia, and the management of that is just hydration with IV fluids. So put together, almost all the management we've talked about is supportive care, but if it's done well, it'll significantly reduce the chance of the patient dying from their MDMA toxicity.